There are a couple new things. Of course, we have our first topical JAK inhibitor, which is really exciting. And that has approvals both for vitiligo and for atopic dermatitis. So that's pretty cool. We have a couple more topicals that are being looked at right now for atopic derm. Both of those are currently approved for psoriasis, and that's topical roflumilast and topical tapinarof. And I'm excited about those. Those are both once daily non-steroidal agents that are anti-inflammatory, anti-itch, so they may have some really nice indications for our kids where we have unmet need. Just in the past couple of years, we have crisaborole that now is indicated down to age 3 months, which is huge because for the littlest babies, we don't have a lot of things. Our calcineurin inhibitors have been out for 20 plus years, but they're only approved down to age 2 in the United States. So this is nice to have something lower. And then our systemic agents, we have dupilumab, which now is approved down to 6 months of age, which is a big deal because, again, for the babies that are suffering from atopic dermatitis, we have had a very limited armamentarium. And finally, we have some things in there, but it's going to keep getting better. We saw adolescent indication initially from the launch for upadacitinib, the oral JAK inhibitor, and then shortly thereafter for abrocitinib, the other oral JAK inhibitor for atopic dermatitis. Now they're both approved down to age 12. So we finally have some real options with some real evidence and a bunch of new indications for the first time in my career. Everything as we saw from vitiligo to alopecia areata. It's really neat to actually have new indications, even seborrheic dermatitis. Just this past year, one of the first treatments specifically approved for seborrheic dermatitis is topical roflumilast foam. So we have some really neat new things that we can use in our toolbox. It's always exciting when we have new treatments because it's not just to have a new toy in the toy box, but also we learn more about the condition. And I call this the virtuous cycle of drug development. We get a new medicine, but that also informs us more about the disease, which then allows for better medicines. But the other point that you allude to is really important as well. And that's, what if we treat things early? Is it possible that we can actually change the outcome of the disease? Can we modify the disease? And the answer is we don't know for a lot of things, but I think there's real potential, especially for atopic dermatitis. I think of it as a disease of vicious cycles where people rev up and the immune system's falling apart, the skin barrier, the microbiome, behavioral pieces are happening. They're not sleeping, right? So you can imagine years and years and years of that kind of abuse to the body takes a toll. What if we could nip it in the bud early, prevent this from happening? Is it possible we could change the course of the disease? And what about associated comorbidities? What about the food allergy? What about asthma? What about allergic rhinitis? All these other things that seem to come after atopic dermatitis for many patients. Could we potentially change the narrative? And I think the answer is maybe. And I'm cautiously optimistic. So I can't wait to learn. And that there's real potential there. I mean, I often joke and say, if it's not enough for you to just spare people years of suffering, and more
Yeah.
and morbidity, which is plenty, that's a big
Yeah.
win right there. But you also might be able to prevent or diminish or delay some of these comorbidities. And boy, wouldn't that be
Yeah.
incredible icing on the cake?